All right, everyone, it's 3 p.m., so we'll kick us off here today. Welcome, everyone. It is great to be back talking to this amazing community of individuals again. I hope you've all been healthy and well. My name is Deepti Nayak. I'm a sales engineering manager at Cisco. I lead a group of very talented engineers that consult and solve our customers' business problems using technology solutions. Today actually marks my 13 years at Cisco, and I must say it has been a fulfilling roller coaster ride. Before we jump into our panel today, I want to just get some housekeeping items out of the way. Today we are hosting this event on Cisco WebEx events. We've muted all of you to avoid any disruption. We have dedicated the last 5 minutes of this conversation for audience Q&A. So if you have any questions, please post them on the Q&A panel, which is at the bottom right pane on your WebEx application. So there are two panels there, the chat and the Q&A. Please use the Q&A panel. Our panelist, Kalina, is tracking them, and if we cannot get to the questions personally today, we will make sure that we address it over email. So with that, today our discussion is focused on how technology can help businesses make better safety decisions as they bring their employees back into their offices. Today, I'm joined by my esteemed colleagues, Jayanthi and Khushboo, and I want to invite them to introduce themselves. Jayanthi?
Sure. Thank you, Deepti. I'm super excited to be here with all of my Cisco folks at Tech Up Women. Hey, folks, I'm Jayanthi Srinivasan. I'm head of product for the wireless business at Cisco, working out of the Cisco Meraki office in San Francisco. And needless to say, I miss our office, especially during mealtimes. So glad to share with you some of the technologies to get us all back to work and doing stuff. Thank you, Deepti.
Thanks, Jayanthi. Khushboo?
Hi, everyone. Thank you so much for joining us today. I am a product manager based out of sunny San Jose, California. That is another, even I miss going back to office a lot. But here we are trying to share some of the secrets that we are sharing with our customers and hope you get to learn something new today.
Cool, thanks, Khushboo. So at Cisco, our priority has always been to help our communities, our customers, and our partners to be effective and agile in conducting their business. As soon as COVID struck, we worked very closely with our customers across various verticals, be it healthcare, finance, education, to ensure that they had enough technology and support to scale their remote worker footprint using some of our technologies like AnyConnect VPN or our virtual office solutions. We also quickly scaled our WebEx collaboration solution to enable effective multimedia collaboration. And it's actually currently being used by over 500 million people. And we are, at this point, clocking about 24 billion meeting minutes globally. Now that certain regions are slowly starting to enter into phases of reopening, we are now thinking of ways that we can be engaging with our customers and talking to them about how we can support them in slowly bringing their employees, their customers back into the physical location safely. So with that, I want to kick off this discussion with a question to you, Jayanthi. Where do you see some of the biggest impacts in technology in the post-COVID world as businesses start to reopen and we start seeing more physical presence in stores and offices?
Sure. I'm saying the obvious here, but uncertainty is going to be the currency kind of going forward in this pandemic world. Social distancing is probably going to be here for a while, and business models are going to change. Regulations are going to rapidly evolve. And technology is probably the only certain bridge that we have in terms of overcoming some of the challenges that surrounds us. Can you imagine kind of going through all this 15, 20 years ago when we didn't have a smartphone in our hands? I definitely can. I mean, imagine doing this with BlackBerries and the old cellular phones and not being connected. It's just unthinkable, really. So definitely technology is helping us greatly to get through this, as difficult as it is. But when it comes to global recovery, whether it's for individuals or for businesses, I think it's going to happen in phases, of course. As an example, in the wake of the pandemic, the key place for technology was all around business survival, business continuity, and business resiliency. So it was really about just how can I stay alive, right? So whether it was pop-up clinics to treat bail or remote healthcare to conserve PPE, or just simply to kick off a remote preschool class, it was all about just focusing on how can we continue to survive. But as we slowly recover, surely and certainly, we'll be looking at different business models. I think revenues will be shrinking across the board. Staff is going to be stretched. And I think cost optimization is going to be huge. And what that means is that we're going to use technology more and more to enable a lot of the new business model and the optimization and costs and so on. And some of the areas, especially, where Cisco plays heavily is around, VPN, wireless, cellular support, cameras, sensors, video conferencing, and even augmented and virtual reality. As most of us can travel, there may be a lot of new applications for AR and VR and so on. So I just see that technology is really going to play a very, very big part, not only in just digital transformation for companies and individuals, but also just to enable us to go through life in a completely different model.
Yeah, I think everybody at this point is sort of rehashing, reevaluating how many people they bring back, how many people they retain. If anything else, is the only constant with this whole situation is that how dynamic it's been, right? And we are constantly having to rehash things. I want to focus on kind of how we are thinking of technology within like our different verticals of customers that we support, right? So Khushboo, one of the things that have started happening in the phased approach is some retail stores have started opening, right? I'm based in New York. Phase 2 included some in-person retail experience now. Most of the stores have a lot of restrictions in terms of number of people that are allowed to enter. They have like physical safety protocols in terms of cleaning and things. But are there any additional insights that you can share with us on how technology can provide an added layer of safety as customers start to come into into physical stores?
Absolutely. So we have at Cisco, we do have a solution called DNA Spaces. So it's a cloud-based, location-based solution where we have different COVID use cases app. For example, one of the use cases you just mentioned, a lot of retail sectors are trying to bringing a system of appointment-based pickup, where you set the appointment and you come in at a specific time. So how can you manage it as an IT administrator, as a store manager? How can you manage who is coming in and who is going out? So using the DNA Spaces solution, the COVID use cases app that we have, you can figure out who is coming inside the building. So for example, at a certain period of time, say at 3 p.m., you are expecting only 5 people to walk into the store for their pickup. Say the 6th person walks in. Immediately, you'll get a notification, whether on WebEx Teams or through an email, and you can see exactly what's going on because safety is first. Another use case, another app that can solve another use case is around we all are always on our phones. Even when we're walking in, it's easier to check your phones than check the signboards around. So as soon as somebody walks in, say for example, any specific retail store, they can get a push notification on their phone, which kind of walks a person through all the different checklist items they have to go through. For example, maintain 6 feet distance, wear a mask, cover your mouth if you're sneezing or coughing. So all these different checklist items can be pushed to a shopper as soon as he walks into a retail store, and it's easier to keep a track of things rather than looking sideways and looking at digital signage, where most of the retail sectors were trying to implement all these different key items to look at. So there are different use cases that DNA Spaces offers, and that is where the world is going, because it's not just investment for now, but even in future, you can keep a track of how best you can deliver the solution to your shoppers.
Yeah, and I think you bring up like a really key point there, right? Because this technology has existed. I think in the past, businesses used this to kind of focus on marketing, or like, hey, in a certain part within a business, there's more customers going in, so that means there's more footfall. So maybe keep our like high priority items there or something. And now we're kind of thinking of ways to use the technology to implement some of these safety measures. right? It's about using the existing solutions more creatively to assist us in this environment. Jayanthi, do you have anything in addition to add to that?
They were being used mostly for like augmenting marketing or just. But the thing functionality is really necessity. And so if you think about the whole contactless engagement, being able to have good like attention. So, I've been wayfinding navigation to the store. Once you open the store, making sure it's systems and all of this technology exists.
Jayanthi, I just want to pause you there for a minute. Quick check. Are you guys able to hear that okay? I'm having some audio issues on my end.
I am having issues too. Yeah, I'm having issues too.
Jayanthi, do you just want to try maybe reconnecting, because the last few words, like when you started speaking, it was slightly garbled.
Okay.
I think the audience. Yeah, thank you. And I think we're getting the same feedback from the audience in chat as well.
Is that better?
Yes, much better. All right.
Okay. I didn't know what it is. It's I was connected through my phone. I was just saying that a lot of the technologies pre-existed, but now we are repurposing that for, post-COVID. And you're absolutely right. A lot of this is going to stay, and we're going to continue to use them, whether it is using Wi-Fi and cameras to monitor the density within a store, or using Wi-Fi to let someone know that you're here to pick up your curbside grocery pickup. All of these technologies are going to be here for a long, long time, just because I think we've gotten to a point where we are using it in many different ways. And I think the applicability has definitely improved.
Yeah. I just want to add one point here, is that at Cisco, our idea is simple: to help our customers to not only revive their businesses, but at the same time help them survive and then in future thrive. So whatever we are doing, whatever initiations we have, whatever products or solutions we are launching is all about helping a customer through these 3 different phases. That's what the plan is.
Yeah, well said.
Great, thanks, Khushboo. Let's pivot to healthcare. I think we've all seen how significantly healthcare has changed in the COVID world. I think most of us as doctors and as patients were not comfortable with the idea of telehealth, but now we've all come around to kind of accepting it. That's been one of the big changes. What are some of the other things that you guys are seeing in terms of technology that we're doing to enable and help our healthcare customers?
Yeah, it's actually a very, very key focus area, simply because, that was the highest need when, things started to go south. Like back in April, it was clearly healthcare was the most hard hit, and it continues to be, right? So there are many, many different applications, but three use cases really stand out for me. And that's really around, first of all, rapid deployment of like field medical centers, drive-through testing centers. And the second one is kind of goes hand in hand, but it's really about being able to monitor patients remotely, which basically enable nurses and staff to monitor maybe 16, 20 different patients through a camera wall. So they don't have to go in and out of the ICUs. And what that also allowed us to do was to conserve PPE, which was just so critical at the time. So that was very, very critical. And I think hopefully the worst is behind us, but I think this will continue to play a very important role. And then the third one is telemedicine, as you mentioned, Deepti. This is going to probably also stay simply because it's convenient. I think it saves costs. Prevents us from having to like commute 15 miles or whatever to get to see your doctor. Personally, I actually had video visits with my doctor a couple of times. I was so smooth. Of course, initially she had trouble with, whether to position her iPad this way or the other, but eventually she got it. But it's amazing how far we have come in terms of using telemedicine and avoiding additional costs. That's obviously a part of hospital visits. So all of this is obviously enabled through various different technologies at Cisco. We are using, again, cellular technologies, VPN, because one thing about healthcare, security is super important, right? Data privacy, HIPAA, security, encryption, all of this becomes super critical. So it's not just about any solution that's going to work for you. It really has to be enterprise grade, has to be secure, and has to be really well tested. So that's why it's really important to have, all of this come together and really provide a robust solution that's being time tested and it's secure as well.
Yeah, and I just kind of want to reiterate the whole security need, right? Because we're starting to see articles around how hackers are taking advantage of folks being remote. There's lesser security application or like lesser security from when folks start working from home. So it's a top of mind for all businesses because initially it was like quick to action, enable everyone. But now as we're starting to like, hey, this is going to last a while, making sure that it's secure, it's robust, and folks are not going to take advantage of it, right? Khushboo, you had some additional comments as well?
Yeah, so actually, so Cisco recently Cisco WebEx recently partnered with Epic. Epic is a software that most of the hospitals and doctors use for patient information. So Cisco recently launched the new Cisco WebEx telehealth solution, which has integration with Epic. So it's basically taking your telehealth solution to a next level altogether. So as soon as a user clicks on the WebEx link to go for his or her appointment, automatically his charts or his records show up on the doctor's screen because of the integration with Epic. That is one thing that was recently launched like a week or so ago. The second solution that we have is a teleworker solution. Jayanthi just mentioned about pop-up hospitals and small hospital camps and all. So how can a doctor kind of go back and connect to the corporate, the hospital network? Because there are certain softwares or there are certain applications that will only open up when you are connected to a corporate or to your hospital network. So a customer or a doctor or a hospital is basically using the teleworker solution. In fact, I have been working with a lot of hospitals starting from back in March, where we help them set up the teleworker solution so that they can have access to the corporate or to the hospital network, even when they're in remote locations, or even wherever they are bringing up the small pop shop hospital campuses. So that is another solution that we're working with. The third thing is, again, DNS Spaces. DNS Spaces is working with different vendors, for example, Stanley Aeroscout, where we are doing temperature-based asset tracking. What it means is that, for example, I remember watching this TV show called Last Ship, where the virologist was keeping the virus sample under a certain specific temperature. And if it falls below a certain temperature, the samples are gone. You can't use them for cure. I'm assuming in the similar way, all our virologists across the world who are fighting to find a cure for this virus will need to keep their samples in a certain temperature, or even within hospitals. For example, blood packs have to be kept or stored at a certain temperature level. How can the management, IT management, or the hospital keep a track of the temperature to make sure that we do not waste all these important high valid assets? So we have integration with Stanley, where you can track your assets or your highly valued specimens using these temperature-based sensors. So you can configure rules and say, for example, if the temperature falls below, say, 60 Fahrenheit, a notification will be sent out to the hospital in charge that, hey, go and look at this specimen. Maybe the refrigerator door is not closed properly, or maybe the seal is not, the lid is not tightly secured. So all these things basically help to make sure that even if there's a human error, we don't have to go through a lot of damages. So these are different solutions that Cisco offers for the hospitals, for the healthcare.
Yeah, that's I think that's really cool and interesting, mainly because everybody is running, especially in a healthcare setup, 100 miles an hour in all directions, with the number of patients that they have to treat. So just having this technology kind of like backup, I think makes it really helpful for the IT or like the business administration folks to like not just rely on like human beings to take care of all of this, right? I guess let's move on to, carpeted offices, because a large workforce, and I think a lot of the people here are probably in more like carpeted office locations, and there's a lot of anxiety around as companies are starting to ask some of their employees to come back physically into the offices. A couple of years ago, open workspaces were the new norm because they were good for communication, collaboration, team building, and things like that. But now we're suddenly taking a total 180, and it's going to be changing. It's going to look very different. So how are we thinking about leveraging some of our wireless or video surveillance technologies as employees begin to come back physically into their offices?
Yes, again, it's a combination of two solutions that we have. One is a teleworker solution, and the other is DNS Spaces again. So with DNS Spaces, a lot of companies, for example, are in this time where everybody's trying to survive. A lot of companies are trying to consolidate their real estate business. I was reading a report where it mentioned that at least until the end of this year, at least the Memorial Day weekend, only say 50% of the workforce, or even like 75% of the workforce, will come back to the offices. So in this mode where everybody's trying to survive, how can a company kind of cut down their expenses? So one way that most of the companies or enterprise customers are doing is by consolidating their real estate business. So once people start coming back in phases, companies are planning to use the DNS Spaces solution to figure out how is their real estate being consumed, whether most of the employees who are coming back are, say, concentrated on, say, floor 1, or it's like spread across thinly across floor 1, floor 2, or floor 3. So using that information, they are planning to basically consolidate all the employees who are coming in, say only on one floor. And they are planning to lease out all the other floors or the other buildings to other businesses, or just ending the lease itself. So that is one way of cutting down your expenses and trying to survive in this mode. The second thing is around employees. So since most of the customers are planning to bring in employees in batches, you can basically configure density rules or density notifications. That, for example, if say 50 people are supposed to come, say on day 1, and say 20 more people just walk in, maybe to pick up something or to deliver something, how can you manage the crowd? So again, you configure density rules or notifications, and as soon as the 51st person walks in, the IT or the building services get a notification on WebEx Teams or through an email, and they can send somebody down to see exactly what's going on. The second thing is the contactless engagement. Most of the enterprise companies, as a guest, when you walk in, you would have to go to the reception and they'll give you the credentials to connect to the internet, or you need a user interface. But in this time right now where everybody is trying to be contactless, what DNS Spaces can offer is a captive portal where as soon as the guest walks in, a captive portal pops up on their phones, and they can log in, and all the important information about how to move around securely and safely, all that information can be shown or can be popped up on their phones. So that is again a contactless engagement. The third thing is around for example, if there is a user who comes to the office and is detected positive for COVID, the companies can go back in time and figure out what are the different buildings or floors that the employee walked around, and they can notify the employees who were there in those spots at that specific time period, and ask them to be in self-quarantine. So there are different use cases on DNS Spaces that helps us achieve the safety for the employees. Along with that, we have the teleworker solutions. So for users who don't want to go to the office until the end of the year, they can still be connected to their corporate Wi-Fi. Yes, we do have the VPN solution where you can VPN through your laptop. And the second solution that we have is your teleworker solution. It's something similar to as if you have a Comcast router, you connect to it, and it starts flashing the network to which you connect to. It's something similar. In a teleworker solution, you have an access point where as soon as you plug it in, the corporate SSID, the corporate network starts broadcasting in your home. So you can get connected without VPNing back to your network. So that is another use case of the teleworker solution, where you don't have to VPN You can use multiple devices, your phone, your iPad, and use a corporate SSID or your enterprise SSID or the Wi-Fi to connect back. And so these are different solutions that we have.
Great, thanks, Khushboo. Jayanthi, do you want to add anything to that?
Sure, I think Khushboo covered kind of most of the categories of solutions that we offer. And we actually, one thing I want to mention, right? So we do work with extensive number of ecosystem partners. And the logic there is that, we can't provide solutions that cater to every single use case out there, but we have enabled every single use case out there by working with ecosystem partners, providing them, APIs and data hooks so that they can basically plug into any infrastructure, any network, and then provide the end kind of, user-facing or consumer-facing solution. And I'll explain this a little bit more. So if you think about it, a lot of the social distancing or workplace occupancy limitations and so on, they're not driven by the IT department, right? So you're probably looking at security and facilities that needs a lot of these applications available to them. So our regular usage of some of these solutions have to be completely changed and reframed so that a facilities person can actually look at their phone and have an alert go on to show that a particular room is not in compliance with social distancing, or a meeting room has way too many people, or there's a congregation that should not be there. So a lot of this is about how the user experience is now very different compared to what we had originally built into some of these solutions. So we are quickly making rapid changes to evolve a solution so that the consumers of the solution, the end consumers of the solution, are able to quickly digest the information without having to learn our products and get a certification or anything like that. So that's a very critical aspect of what we are trying to do, and being very agile about it, because all of this is required yesterday and we can't wait for like another 6 months or whatever, right? So working with ecosystem partners, we are trying to basically elevate the options that's available to our customers, so they can pick and choose. If you're a restaurant, you have your own solution. If you're a Macy's or you're a store, you have your own solution. If you're a farmer trying to like open an outdoor market, you have your own solution. And if you're a healthcare vendor or a corporate office, you have a different solution. So the solutions are very, very different depending upon who the end user is. But at the core of it, it's really about monitoring density, monitoring social distancing, building occupancy, keeping safe distances, and identifying peak entry and exit. There are applications to actually kind of provide your schedule for when you're getting in the office, and have your phone to work as a door unlock to unlock the door, so you can get in and out without touching anything. So it's very sophisticated. Some of these, even what our ecosystem partners have, are very sophisticated solutions that are definitely very well tailored to a lot of the use cases. There is one thing I want to point out though, Deepti. There are some caveats, right? It's not all utopia. And in the end, it's really about bringing technology and people together. It's not a replacement for what is required by the humans, but it's a huge, complement or an augment to what people can do. So it's really going to work kind of hand in hand with what, people like ourselves, how we follow the rules and how we stick to social distancing. There's obviously some tricks also to make sure that, we are allowing technology to help us, providing incentives to employees so that they adhere. Like, for instance, if you need an app to make sure that social distancing rules are followed, you cannot force anyone to have the app on your phone, right? Because there's also data privacy laws that we have to adhere to, and we have to make sure that we do not, make any compromises when it comes to security and privacy. So there's a little bit of working with the employees, working with the people, providing incentives to let them understand that anything that is being done using technology is done to really make it safer and more secure for the employees. And I think at the end of the day, it's also about kind of the crowd mentality of let us all follow the rules, let us all make sure that you're using the technology. And that really helps to kind of encourage the employees, encourage the staff to adopt some of these, because technology is only as effective as how it is implemented or how it is used. And so that's a very key part in all of this, because it's not just set this up and it's all going to work. It's really working in combination with the people.
Yeah, absolutely. I think that was some really interesting comments and feedback from you guys. Thank you so much for taking the time to share that today. We are at the top of our allotted slot. And Kalina, are there any questions? Maybe we can take one and then address the others post-event.
Yeah, I'm not seeing any questions from the audience. That's not just me, right? No, okay. I had written a few questions. If we have time for one, does that make sense?
Sure.
Yeah, let's do it.
Cool, yeah. So you guys talked about customers changing the way they operate due to COVID, using new technology and then using their existing technology in new ways. From your experience talking to customers, is there anything that separates the ones that have been able to successfully pivot from the ones that are struggling or, that struggled in that transition?
Yeah, that's a great question. And I think, it's a really good question. So here's what I have observed. So companies that were already kind of in the path of digital transformation, where they had, figured out how to move everything more and more into an automated world, they have definitely been able to move on to this new model very quickly, very easily, because a lot of it is about the mindset, right? And then by the same token, other companies that have not really gotten on the bandwagon yet, they definitely had trouble making that first step. So I think definitely a lot of the enterprises that were already on digital transformation were definitely very effective in quickly reacting, getting to a mode where they could just do it, right? In 2 days, everybody went, like Cisco as an example. We all went remote in 1 day, less than a day. So there's a lot to be said about that preparedness. I mean, not everybody expected a pandemic, but I think just being there already helped them to get to the next step.
Great. Thank you, Jayanthi. All right, thank you so much, ladies, for sharing your thoughts and insights with us today. And Kalina and Don, I want to thank you again for your support as well. I hope you all found this informative, and our contact details will be made available to you. So if there's any questions or follow-up that you'd like to have, please don't hesitate to reach out to us. And have a great July 4th, you all. Be safe, wear your masks, and stay healthy. Thank you.
Thank you so much.
Thanks.
Bye.